Pharmaceutical and biotechnology leader Pfizer has pledged 11 million rand for the establishment of 9 more clinics in underserved communities. Known as Unjani Clinics, these non-profit network of nurse-owned and operated primary healthcare clinics serve mostly rural communities that struggle to access healthcare facilities. Pfizer says it's pledging more money as part of celebrating International Nurses Day, marked all over the world today. We're joined now by Kevin Francis, who's a cluster leader for sub-Saharan Africa and country manager for South Africa at Pfizer. Thank you very much, Mr. Francis, for your time this evening here on South Africa Tonight. Can you tell us a little bit more about which provinces are going to benefit from this 11 million rand pledge?
Good evening, Annalene. Thanks for having me on the show. The funding from Pfizer will help to establish an additional 9 clinics, and these will be specifically in 8 provinces, that is Gauteng, KwaZulu-Natal, the Western Cape, Northern Cape, Eastern Cape, Mpumalanga, Limpopo, and the Northwest Province. Now, this equates to an additional 144,000 additional patients with the 9 added clinics. So overall, the 17 clinics that have been sponsored by Pfizer since 2016 will reach an estimated 259,000 patients annually.
So we're made to believe this initiative has already helped to set up around 150 clinics nationally. What's the end goal here?
The end goal is that by 2030, Unjani wants to have established over 600 clinics in South Africa. And that is our reason for starting off this partnership back in 2016 and assisting them on an annual basis to help them achieve this goal. The primary purpose of this goal is to strengthen the healthcare system in South Africa, specifically within the primary care setting in those underserved communities that you mentioned earlier. So the nurses are aptly suited, with 80% of them being present and residing in those underserved communities to actually serve these communities even better with primary health care.
What's the relationship between these clinics and government-owned clinics in the same communities or in the areas?
In the South African setting, we have clinics in both the private sector and the state sector. However, we have a huge healthcare burden, and these clinics actually complement the current system. We know that there's a huge disparity between the private healthcare and the public healthcare system in South Africa, and Unjani serves to actually take some of this pressure off the public healthcare system by providing this valuable primary healthcare setting.
Talk to us a little bit about the services. Do they provide free healthcare or do they charge for services? We understand the communities where they operate are underserved, rural, employment is challenging. A lot of these households come from low-income groups.
That is absolutely a very important question. So the way the model works with Unjani is that they provide a capitation fixed fee for consultation, medication, and diagnosis. So a patient attending any one of these clinics pays a fixed fee of 250 Rand, and basically they receive all their treatment, all their diagnoses, and all their tests. So be it whether it's a stoma that needs to be conducted for a pregnant woman, all of that is covered within the 250 Rand.
That's an incredible service. We know we have a very strong community health sector that was evidenced during the COVID-19 pandemic. Nonetheless, we do have some challenges still. What are some of those challenges that you think these facilities address specifically?
I think specifically it goes towards strengthening healthcare systems. I mean, in South Africa, we've seen a huge challenge, particularly during the pandemic, where we know that the nurses have played an integral role in attending to the healthcare needs of patients, particularly in the rural areas. The reason I say that is because the nurses have a profound knowledge of not only health issues, but social challenges and resource limitations within these communities that they reside in. And as such, they are well placed to build trust with patients. We know that nurses do more than just care for patients. They are advocates for health, education, innovation, and they also provide ongoing assessments for patients' health. So we believe Pfizer's ongoing investment with Unjani Clinics helps to ensure and contribute towards a sustainable access to primary health care for patients in resource-constrained settings that are prevalent in the rural areas. So as such, nurses save lives, and as the largest profession in the health sector, they will continue to play a vital role in the future of the South African healthcare system, together with Pfizer.
Thank you so much for speaking to us this evening. That was Kevin Francis, Pfizer's country manager for South Africa, giving us some details on that 11 million rand pledge.